I don't know if it's the heat or what. I just feel a little short of breath, and it feels like I can't catch my breath. It feels really heavy. I just don't feel right. So,
okay, I think I'm going to dial 911.
You really think it's necessary?
I think so.
Oh, I don't know.
911, where's your emergency?
Hey, I'm at the fairgrounds, and I'm with a friend of mine who's not feeling very good, and I'm just wondering if she needs an ambulance.
Okay, sir, whereabouts at the fairgrounds are you?
We're in the special event tent just east of the home ec building.
Okay, sir, and how old is the patient that you're with right now?
Mary, how old are you?
I'm 53.
She's 53.
Okay, sir, and she's awake and talking okay?
Yes, she doesn't feel good though. I think we need some help right away.
Okay, I'm going to go ahead and get some help started that way, sir, and get the call started. Now, what kind of symptoms is she having?
She's very sweaty, and she's saying she can't get her breath, can't catch her breath.
I feel like I'm going to throw up.
She feels a little nauseous, it sounds like.
Okay, sir. Just one moment, I'm going to get some help started that way for you.
Okay, I'll hold. They're going to send an ambulance.
Attention Squad 7 and Medic 7. Squad 7 and Medic 7. Have a medical run. Squad 7 and Medic 7 have a medical run. It's going to be at the Tippecanoe County Fairgrounds. The Tippecanoe County Fairgrounds is going to be just east of this home ec building at the special events tent. Just east of the home ec building at the special events tent. Have a 51-year-old female not feeling well.
You feel like you're going to pass out?
And feels as if she's going to vomit and pass out. First home time's at 14:09.
Oh, man.
Medic 7 en route.
I wasn't feeling good this morning, but so I was hurrying around because I wanted to get
Squad
here.
7's en route.
I was going to see my niece and nephew at the judging.
Okay, sir, are you there?
Okay.
So I was hurrying. I didn't think nothing of it. So
7927, 7925 en route.
We're probably doing the right thing. We'll get the ambulance here and let them check you out. If you
Okay,
need to go
sir.
in, they'll take you in. Yes.
Okay, sir, are you there?
Yes, I am.
Okay, I do have help on the way. There's also a couple of deputies there at the fairgrounds that were clearing the dispatch, and they're going to come over and try to help you guys out there until emergency responders can get there. How's the patient doing now?
She feels like she's going to pass out, but I've got her here sitting in a chair. We'll just wait here until help can get here.
Okay, sir, just keep monitoring her breathing and everything, and let me know if there's any change in her status until help arrives.
Okay, the deputies are just walking up here now.
Okay, sir, since the deputies are there with you, I'm going to go ahead and disconnect. Thank you.
Okay, thank you much. Bye.
Bye-bye.
You don't feel good?
Yeah, she doesn't feel good. I just got off the phone with 911 and they're sending an ambulance, and I think the fire department.
Okay, I think they're pulling up right now, so.
Okay, all right. I hear him now.
Okay.
You're okay.
they're getting here fast.
Yeah.
Some of the fire trucks here.
There, Squad 7's arriving.
Yeah, they're just.
Oh man. I just don't feel well.
Okay.
You're okay.
They'll take care of you as soon as they get here. Do you have any other medical issues?
I got a few. I'm a diabetic and I have high blood pressure.
Okay.
But I take medicine. I didn't take my blood sugar this morning, but I ate my breakfast.
Okay.
Took my medicine the way I'm supposed to, because, you know.
All right, with the fire department, what's going on today?
Oh, I just don't feel good.
Okay. When did this all start?
Well, I was telling him I didn't feel good this morning.
Yeah, let's get a pulse ox on her and get a blood pressure for her.
But I didn't want to miss the judging, so
Okay.
I came.
What kind of medical problems do you have?
I'm a diabetic.
Diabetic? Okay, have you checked your sugar lately?
Well, I forgot to do it this morning, but I took my medicine and I ate my breakfast.
Okay.
And then I also have high blood pressure that I take medicine for.
Okay.
She feels a little
Any family
lightheaded,
history
she
of
said as well.
cardiac disease?
I'll just get out of your way.
Yeah, everybody on my dad's side
Has heart disease?
has heart
Okay.
disease, and everybody on my mom's
brothers
side.
and sisters?
My brother has a fast heart rate,
Okay.
and he takes medicine for that.
Okay.
Where do I put this on your phone? Finger, okay?
We're just gonna see a couple things going. The ambulance will be here in just a minute and we'll get you moving here. Which hospital do you go to?
I normally go to STEMI.
Okay. Do you have chest pain, pressure?
It's like a pressure, like I can't catch my breath.
104 and 98.
Okay.
That's a little fast for me.
That is a little fast. Okay.
It's like our ambulance is here, so we let me see this. That's good, real quick.
Blood pressure is 130 over 110.
Take a deep breath for me. Another one. Deep breath. Okay.
So do you think I really got to go to the hospital?
I think so. It'll probably be a good idea. The ambulance is going to be here and I'll do a couple more things for you. But I think it's a good idea to go in and get seen.
Well, I've already called my husband. Think you could call him to tell him to meet me at the hospital? Because otherwise he's coming here.
Yes, I can.
Okay.
Hey guys, 51-year-old female start not feeling well. She's a diabetic, history of family heart disease. She's got a pressure in her chest. Lung sounds are nice, clear. Feels like she can't catch her breath.
Okay.
Diabetic, she's not checked her sugar, but she took her insulin 8 this morning.
Okay, my name is Jenny and this is Mitch. What's your name?
My name's Mary.
Hi, Mary. So you're not feeling well? And how long has this been going on?
Well, just since we've been sitting here, but I've not felt good all morning, and I've been in the hot arena.
Okay, what we're gonna do right now is we're gonna have you sit on the cot and then we're gonna put the monitor on you and we're gonna check your heart and see how that's going. Okay. Then we're gonna give you some.
Pulse ox was good. Rate's a little fast.
Swing your legs over there. Say your name was Mary, right?
Pressure yet?
Yeah,
What's the
130
pressure?
over 110.
Mary, I'm gonna start putting you on my heart monitor, okay? So I'm gonna put some stickers across. So we're gonna take a big picture of your heart real quick too, okay?
Hold that off on that one just a second, bro.
Do you take aspirin every day?
I have a medicine list in my here.
4 baby aspirin there.
Stickers here. I'm gonna put some up here and they're gonna come around your chest, okay?
Got some little baby aspirin here for you. There's 4 of them there. Go ahead and take those, chew them up. They don't taste very good.
So you're say you're having some chest pain then too, or some chest discomfort? I'm gonna give you a spray of nitro. Side effects of this is can give you a headache, okay? Pretend. Spray, okay. Let that dissolve under there. Sprays at quarter after.
On that side.
Just gonna put these on you so we can get that 12 lead EKG, okay?
How old are we again?
I'm actually 53.
53. Okay.
You guys want to put her on a little bit of oxygen?
I got a bottle up here.
on the head of the cot, guys. Alright, Mary, when we take this picture, I need you to try to breathe normal. Don't talk and just hold real still, but I'll let you know when we do that, okay?
Okay.
Okay. Real still.
Put that in your nose. That's all junk.
See if that'll help just a little bit.
Alright, guys, I'm gonna take a picture, okay? So everybody just hold real still, breathe normal, just don't talk.
Now once this EKG is done, we'll be able to fax it to the hospital, and so they'll have it right away also, okay? What's it look like, Mitch?
Still analyzing.
So no history of heart trouble? Any family history of heart trouble?
Yeah, everybody on my dad's side.
Everybody on your dad's side has a history of heart trouble? Okay.
My grandma had open heart surgery.
Okay. Yeah. Okay, Mary, it looks like you are having a heart attack. So, but it's okay. We're going to take good care of you, okay? As soon as we get in the ambulance, we're going to call the hospital. They're already going to have a picture of your EKG, and we're going to call them. They'll have the cardiologist all ready for you. The cath lab will be set up for you. Okay, so we're going to get you good taken care of. Okay.
Jenny already faxed it for you.
Okay. Fax leads
So
card.
it should be at the hospital.
You noticed any difference with that spray of nitro that we've given you?
Maybe just a little bit,
just a little bit?
not a lot.
Let's go ahead and get her to the truck.
1, 2, 3.
You guys need a driver to the hospital. Okay, get your driver. All right, thank you.
Mike, go ahead, take care of the driver.
Thank you very much.
Yeah, I called my husband, but he was going to
I'll
come
carry it for
here.
him.
He needs to know to go to the hospital.
Okay. If he comes here, I'll let him know where you're going.
Okay, well, I think my friend was going to call him.
Friend's gonna call him. Okay.
Anything else, Jenny?
Nope, just the driver.
Just the driver, guys.
Dang, Mary. I'm going to get another blood pressure.
You guys ready?
We're good.
Okay, Mary. We're going to go. I'm going to go ahead and call the hospital. Mitch is going to go ahead and start an IV, and we'll get things going from there. Okay.
Is that medicine helping at all yet?
Oh, maybe a little
Yeah,
bit.
this is Jenny
Not
with
a lot. It's
Medic
still-
4. We're en route with a 53-year-old female that about a couple hours ago began having some chest discomfort. She doesn't really call it a pain, but she says it's chest discomfort and some felt like she couldn't catch her breath. She's pale and diaphoretic. Did you say you were nauseated at all?
Oh, yeah.
Some nausea, but no vomiting. We checked the first initial set of vital signs. They're 130/80. Heart rate right now is 110. Respirations are about 24. She states that she can place the discomfort about an 8 on a
Put a
10
big
scale.
rubber band around your arm here, okay?
We put her on the monitor. She's in a sinus rhythm, but she's got some elevated ST segments in lead 2. We did a quick 12 lead. We do have a STEMI and inferior MI. We've got elevation in 2, 3, and AVF, and we've got some reciprocal changes in 1 and AVL. We have sent the first EKG. You should have it on the machine now. We have went ahead and put her on a couple of liters of O2, and we're getting ready to start a line on her right
You're
now.
gonna feel a big poke in your arm here, okay?
She's
Ready?
had 1 spray of
1,
nitro,
2,
and
3,
she's had
and poke.
4 baby aspirin up to this point.
All right, almost done. A little pressure,
She said
all
her
right?
pain's a little bit better since the initial spray of nitro, and so we're going to be continuing with that treatment at this point in time. We have an
Little
ETA
medicine
of
through here might
about
give you a funny
5
taste in your mouth,
minutes.
all right?
Do you have any questions for me? Okay, we'll see you in about 5.
All done, just a couple pieces of tape, all right? Jenny, we got an 18 gauge IV in the right AC
Okay.
here.
When you have symptoms like this, it's always a better idea to call EMS because we can get there and we're like a mini emergency room. We have all the things at hand right away that we can
got tape
get
for
things
you,
taken
Jenny.
care of. Okay.
Well, that's good to know. You guys came so quick.
That's what we're there for. Pressure, I'll take the blood pressure. You want to go ahead and draw up some fentanyl maybe for her pain too?
Yep, we'll do that. Are you starting to feel any better yet? Is that chest pain going down? Chest discomfort?
It's still like a pressure, but the nausea is a little bit better.
Nausea's a little better?
The medicine's working.
Good.
It's doing its thing. Blood pressure
much
still
fentanyl do you
staying
wanna give her?
stable.
All right, we're here at the hospital, okay, Mary? Here's what's going to happen, okay? We're going to take you right out on this bed. We're going to wheel you into the emergency room, okay? There's going to be a lot of people waiting there for us, all right? They're going to have a lot of the same questions that we did. Just answer them the best you can, all right? And we're going to take real good care of you. Rail over here, okay?
My side.
Yeah. All right. Mary, there's going to be a couple bumps. Just sit real still for us. How you doing?
That pain getting better?
Not too bad.
Okay.
Couple little bumps, Mary.
Oh, this is cold.
Yeah, they keep it a little cool in here. Excuse us.
Hey guys.
Hey, Dr. Parker, this is Mary. Mary began having the chest discomfort, nausea, diaphoresis, and paleness about 2 hours ago. You've got our 12 leads. We've sent a second one, looks about the same. And a total of 3 nitro and 75 mics of fentanyl. She says that she's still only about a 7 on the pain scale. And nausea's a little better with the Zofran. She's still uncomfortable, still a little bit diaphoretic.
All right, Mary, just hang on. We're gonna move you over here in just a second, okay?
Okay.
Mary, my name's
My
Megan.
last
I'll be
blood
your nurse.
pressure was 110. Heart rate was 92. Respiration was about 20, which was at 100% on the 2 liters of oxygen. Ready?
Everybody ready? 1, 2, 3.
She's got 2 IVs, 1 in each arm.
Amy, can you go ahead and put on a monitor for me? Okay, see if we can get a EKG, please.
Do you have any more questions for me, Dr. Parker?
All right, Mary, a lot of cold
thanks a
stickers
lot.
on your chest, okay?
Hey, Miss Mary. I'm
Hey.
Dr. Parker. How are you?
I don't feel very good.
Not feeling very good, huh? What were you doing?
Well, I got up this morning and I was just a little weak, but I had to go to the fair to watch the judging for my
Yeah.
niece and nephew because I didn't want to miss it. But I started getting hot and just wasn't feel good. I started getting a little sick to my stomach. I thought I was going to throw up, but I never did.
Okay. Did you break out in a sweat?
Yeah, I did. But
Competition must have been brutal, huh? Yeah?
yeah, they still got a blue ribbon.
All right.
Yeah.
Good deal.
But
So
I
when
just-
your pain first started, what part of your chest was hurting you? Right there?
It's like right here. And
Did it go anywhere else?
No, it just stayed right there, but it was just real tight.
Okay.
I just didn't.
Yeah,
I just
okay.
didn't feel good.
All right. You got any heart problems you know of?
No. My family's got it, but on my dad's side. But
Do you take any
Not me.
medicines every day?
yeah, I have a little high blood pressure, so I think it's lisinopril.
Okay.
I
Yeah.
take, and then I take a little bit of Lasix to
Okay.
help.
All right.
And I'm a diabetic, so I take metformin and I try to watch my diet.
Any allergies to medicine?
No.
Well, I'm glad you called 911 because based on this EKG, looks like you may be having a heart attack.
That's not good.
No, not good at all. But we're going to take good care of you, okay? You're going to see a lot of things happening, okay? A lot of things going really fast.
Okay.
That's just to take good care of you in a speedy fashion, okay? Cardiologist today, his name is Dr. Brodell. So as soon as we get some blood from you, we're going to give you some more medication, and then we're going to have to take you to the cath lab to actually go inside your arteries and look and see anything blocking the flow of artery to blood flow to your heart. That makes any sense?
Yeah.
You sure?
Yeah, like I said, my family's gone through this before,
Okay.
so.
All right, we're going to take good care of you, okay?
Okay, thank you.
And she had asthma.
Bolus of Angiomax.
Absolutely. And
She's-
go ahead and start the bolus as well as the infusion out.
Okay. Based on your weight, I'm going to give you some medication that they want you to have down in the cath lab, okay?
Okay.
I've given a total of 8.3 mils for the bolus. I'm going to start the Angiomax.
There's that cold saline
Like you
flush,
said, the plan
okay?
is to take it to the cath lab. Let me readjust this here. So I will need a consent sign.
Okay.
And Dr. Brodell will be the cardiologist, okay?
Okay, well, my husband should be here anytime they called him. Somebody called him from the fairgrounds.
Okay, so he's aware. Is there anybody else you want us to notify?
No.
Are you right-handed?
Yeah.
All right, here's the
It's
pen.
not going to be pretty.
The best you can right now.
Miss Mary, what is your pain right now on a scale from 1 to 10?
It's about a 6 or a 7.
6 or 7. We got the nitro started.
I'm getting that right now.
All right. And we can go ahead and give her 4 morphine as well.
Okay.
Do you still feel nauseous?
Not as much.
Not as much, that's
No,
good.
It's better.
Yeah.
And do you have the ice stats running?
Yep, they're
The
cooking.
creatinine
Nice.
and the troponin?
Your blood pressure looks good, so to help you with that pain, I'm going to give you a little bit of pain medication, okay?
Okay, great. Thank you.
Hey, Miss Mary, So I just got off the phone with the cardiologist. We're about to take you to the cath lab, and then he'll come in here briefly, kind of talk to you, explain what's going on, and then he's going to go to the cath lab where he can get sterile and get ready for the procedure. Okay? Do you have any questions for me?
No.
No? You
Guess
sure?
not. Yeah.
All right. How's your pain right now?
It's getting better.
Yeah.
It's probably about a 4.
4? That's good. That's good. Right? All right. Well, we're going to get you all squared away. We got the consent signed?
Yep, we have all the paperwork ready. I'm just getting ready to get everything packaged and we'll take you to the cath lab here, okay?
Your vitals are all
Thank you.
looking pretty good.
Great.
All right.
Thank you, guys.
He was coming downstairs right now.
We'll just go ahead and get this all ready.
Yep.
Hello, Dr. Burdell. Good afternoon. This is Mary. Had some central chest heaviness with some nausea, kind of dizziness. Started about an hour, 2 hours ago while she's at the fairgrounds. She's had her angiomax bolus and drip. She's on some fluids. She had nitro and morphine, as well as a Plavix and aspirin. And her pain is now 0.
Thank you. Hi, Mary. My name's Dr. Brodell.
Hi.
Your EKG shows evidence that you're having a heart attack. Heart attacks happen when they're blocked or narrowed arteries on the heart. When one of those arteries closes completely, all the blood flow stops and that segment of the heart muscle dies. What we're going to do is get you over to the cath lab as quickly as we can to try to open that artery up. We'll give you some medicine in the IV so that you'll be comfortable. Then we'll numb you here in the groin. The numbing medicine burns and stings for a few moments. After that, the sensations are pulls and taps. We'll put a small needle in the artery, then take catheters around to the heart and inject X-ray dye into the arteries one at a time and take X-ray movie pictures of them. Well, if we find a blocked artery, and I think we probably will, certainly if there are multiple severe blocked arteries, balloons and stents aren't the best choice. That's when bypass surgery does a better job. I'm not predicting that or wishing it on you, but it may be the case and we may need to discuss it later.
Okay.
Do you have any questions or things you want to go over?
No, everything's just so fast.
I think the risk for this is less than 1 in 1,000. Less than 1 in 1,000 for heart attack, stroke, or severe life-threatening bleeding. But the heart attack is 100%. We ought to get this going right away.
Okay.
Good to go.
Thank you.
Cath lab we go.
All right, and we have the consent ready. Let's go. All right, Mary, are you doing okay?
Yeah.
All right, sorry, just there's a tight fit through those doors. There we go. And I'll show you on our way where your husband will be.
Okay.
We have a cath lab quiet room so you can sit and they can update them for you.
Okay, thank you.
They're both closed. Do you want to try this one? We'll go in first. All right, Mary, we're going to back in here, okay?
Okay.
Hi.
This is Mary. She's a 53-year-old female. Has one on each side, 18 gauges.
Let her move, or we're moving her without the board?
Okay. 1, 2, 3. Doing okay, Mary?
You got arm holder for this side, Mary. There we go.
Scoot your hips this way just a little bit. Towards this one.
I'm gonna go get a warm blanket. Are you cold, Mary?
Yeah, it's pretty cold in here.
I'm gonna get one.
And her husband is en route, so we'll have him in the STEMI quiet room.
Okay, Mary, everything's coming along fine. Are you still having some hurting in your chest, or is it better?
No, it's better.
Great. Millions of people every year are affected by heart attack. Heart attacks happen when there are blocked or narrowed arteries on the heart, and when one of those arteries closes completely, all of the blood flow stops and that segment of the heart muscle dies. If you have the symptoms of a heart attack, pressure, tightness, or squeezing in the chest, throat, neck, or jaw, often associated with sweating, shortness of breath, or nausea, the care begins when you activate the system and call 911. The emergency medical crew is able to give you appropriate medicine and can do an EKG and transmit that to the emergency department so that we can be prepared when you arrive. The sooner we can restore blood flow to your heart muscle, the less damage there'll be. So time means heart muscle.